各位委員，夠鐘亦都夠。
Members, it's time when we have a quorum. This is the meeting of the panel on transport. Since the last meeting, information papers have been issued. Since the last meeting on the 21st of April, there are four documents in total, and the details are in item 1 on the agenda. Next meeting, 16th of June, we're going to cover three items. Improvement works at Ching Interchange, dueling of Hiram's Highway from Marina Cove to Sai Kung, and use of electric mobility devices in Hong Kong. So please refer to the paper for details. Any comments on the three items? No, then we will take up these three items at the next meeting. And then next we go to item 3 on the agenda. Requirements for physical fitness certification of driving license applicants or holders. Members, please note that yesterday afternoon and evening, the Secretariat received 2 submissions from the Federation of Hong Kong Transportation and Logistics Industry Unions and the Hong Kong Taxi Council. The 2 submissions are tabled for your information, please. Now we'll invite the administration to join us. Yes, I will invite the administration to join us, please. In accordance with Rule 83A of the Rules of Procedure, if members have any direct or indirect pecuniary interest on the items for discussion today, please declare the nature of such interests before you speak. I understand that there is a PowerPoint presentation for this item. Can I invite the administration representative? Is it Mr. Mack? Okay, Mr. Mack, please. Or Commissioner, rather. Yes, members may press the request to speak button now. Thank you, Mr. Chairman. Today we're to consider the review of requirements for physical fitness certification of driving license applicants or holders. The physical conditions of drivers are of vital importance to ensure the safety of road users. The government has all along been concerned about the health conditions of drivers and has been closely monitoring the physical fitness requirements of drivers and related issues, as well as strengthening publicity efforts on road safety. It is a fact that we have an aging population in Hong Kong. The number of aged holders of driving licenses is on the increase year by year. And also in recent years, we've seen a number of accidents involving drivers of commercial vehicles. Therefore, the government is attaching even greater importance to the review of the requirements and mechanism for physical fitness certification. Under the road traffic driving licenses regulations, Cap 374B. So we have conducted a review, and we have more or less completed the review. Now, because there is involved medical knowledge, so in the second quarter of 2022, the Transport Department commissioned a consultancy team from the Hong Kong University to give us professional medical advice, and also they will help us with or give us support on drafting of amendment legislation. And this is the team from the School of Public Health of the Hong Kong University. And also an expert panel was set up in June last year, comprising representatives from the TLB, Department of Health, Hospital Authority, the Hong Kong Academy of Medicine, with representatives from the family physicians, community medicine, and ophthalmologists. They will help us with the review work, and Professor Low from the expert panel is present here. That is Professor Joseph Loy. He's here too to help us answer questions from members. The consultancy team conducted literature review and explored various issues, and they've also conducted studies and data analysis, and they've come up with 6 recommendations. We'll go to that later. Now, we understand that the different sectors may have different views on such issues, but we must stress that we're proposing more stringent physical fitness examination. This is to help drivers better monitor their health situation. Also, they come to become aware of any health issues they may have, and so they could seek early treatment. But of course, the arrangement is not to help people get treated, because seeking treatment is one's own responsibility. But then, if diseases or illnesses are identified early, then there could be early treatment and control of the disease, and then they could continue to drive safely on the road. And also, with the proposed arrangement, we could also take care of the livelihood of aged commercial vehicle drivers. Now, we know that aged drivers have expressed concern about the fees for the medical examination. So we will first compile the guidelines, and then we will also listen to the views of the sector and other stakeholders, and then we'll then consider the fee levels, and then we'll see whether there is need to subsidize aged commercial vehicle drivers in taking the physical examination. Now, of course, there is a public fund. There are public funds involved, so we have to study the arrangement very carefully, and it's important that we are able to prevent abuse. And also, we have also looked at the practices in other jurisdictions. For example, Australia, New South Wales, Singapore, they require aged drivers of certain types of vehicles to take road tests. In the mainland Canada and UK, they don't have such road test requirement. And South Korea plans to introduce a simulated driving test for aged drivers aged 65 or above from 2025. We have considered the road condition in Hong Kong and the traffic situation here. We do not propose to mandate a road test for aged drivers for the time being, but we will consider using whether simulated driving test is feasible to test the ability to drive and response in different scenarios for local age drivers, and then that will help us to assess their fitness for being granted a license. Now I'll invite my colleague, Ms. Falk, to take you through the 6 recommendations. Yes, I will go through the 6 recommendations. They're actually in paragraph 16 of the paper. First, tightening the requirements by amending the diseases or physical disabilities specified in the first schedule to the regulations. The diseases and physical disabilities are spelled out in Annex 1, that's the first schedule. There are now 7 items. If the applicant has one of the diseases or physical disability, we will not grant a license, or we will cancel the existing license. We propose to keep items 1 to 5 and 7. As for item 6, we will make amendments to add further eyesight requirements. We will specify the requirements on visual acuity and visual field, and for drivers of commercial vehicles, we are going to make higher requirements. And then if there are 8 diseases, one of the 8 diseases, and we will not issue a license. One is hearing loss of more than 40 decibels measured across the lower frequencies for the better ear, with hearing aids if necessary. Second one, monocular vision 3 in insuperable diplopia, and 4 nyctalopia, 5th dementia, 6 malignant brain tumors, 7 implantable cardioverter defibrillator, and 8 chronic lung disease with usage of supplement oxygen. If a person has one of these 8 additional diseases, then we will not issue a driving license for commercial vehicles. And the second recommendation is enhancing the requirements for submission of physical fitness certification by commercial vehicle drivers. At the moment, applicants over at 670 or over will have to submit a physical fitness The certification and the validity period is from 1 year to 3 years. And in future, we're going to lower the age threshold to 65 or above, and the validity period is only 1 year. The third recommendation is adjusting the content of the medical examination certificate, and there will be more stringent standards for drivers of commercial vehicles. So we will establish and differentiate the physical fitness standards for persons driving commercial and non-commercial vehicles. There will be more stringent standards for drivers of commercial vehicles. Eyesight and hearing tests will be compulsory. I mentioned that we're going to amend item 6 of the first schedule, and also the list of illnesses, of diseases and disabilities will be included in the certificate. And also, the applicants have to declare their own situation so that doctors will have a better idea of this condition. The fourth recommendation is drawing up relevant medical guidelines for medical practitioners. So medical practitioners will have clearer guidelines for conducting the medical assessments and completing the medical examination certificate, and they will also know what the points to note and so on. And again, there will be distinction between the physical fitness standards for drivers of commercial and non-commercial vehicles. And then on the new items, visual acuity, visual field, hearing, and so on, there will be methodologies for screening, and there will also be criteria for further assessments and follow-up for reference by doctors. The fifth recommendation, empowering the Commissioner to require submission of medical reports by driving license applicants or holders. Now, from our experience in handling suspected cases, we believe there is need to plug the potential loopholes in the current handling procedures. We propose empowering the Commissioner to require a driving license applicant or holder with doubtful health conditions to submit a medical report. If the person fails to do so, then we could cancel or suspend, revoke or suspend the license. Sixth recommendation, imposing a more stringent age threshold for submission of physical fitness certification by driving instructors in one go. If a driving instructor also gives driving instructions on commercial vehicles, will also lower the age threshold from 70 to 65 in terms of the physical fitness certification. Thank you. Well, there are many members who wish to ask questions. I've actually set aside 45 minutes. Now, instead, I will set aside an hour for the discussion. And since there are many members who wish to speak, so please allow sufficient time for the administration to reply to your questions. So it will be 4 minutes each, okay? And I will stop you at 4 minutes. After Mr. Chen Hak-fong speaks, I will draw a line. So if you wish to ask questions, members, please press the request to speak button as soon as possible. I'll read out all the Chen Hak-fong dominantly. Michael, 10 Michael, Look, David Lam, Charles Siu Chong, Lo Wai Kwok, Frankie Yik, Yu Park Kang, Leung, Chang Siu Chong, Kenneth Lau, Ben Chen, Dennis Leung, Stanley Lee, and Gary Zhang. Mr. Chen Hak-fong, please, 4 minutes for questions and answers. Thank you. For the physical examination requirement, this is form of protection for both drivers and passengers, because we have seen in recent months there is a high proportion of accidents involving aged drivers. But then the Bureau and the department must be aware of a situation, especially drivers of commercial vehicles. Now, young drivers will drive buses because the pay is higher, $20,000 or $30,000 a month. But when they retire, then they go and drive public light buses, so they earn a steady income. And then for the even older ones in the 60s or 70s, then they go and drive taxis because there's more flexibility there. So it's the current public transport ecosystem. That's why that we see older drivers of taxis. And if you impose stringent requirements, that will impact on the supply of taxi drivers. Now, given our advanced healthcare system, for people who are age 65, they are still very healthy, as you can see among members here. So is it the case that we should draw the line at 65? What about between 65 and 70? So there could be examination every 2 years, and it's only after 70 then it has to be an annual examination. Can we do that? So there's some sort of transition, and then you don't force everyone to go and take the physical examination, because for most people at 65 these days in Hong Kong, they are still rather healthy. And if you push all of them to go to private doctors for examination, the burden will be heavy. Yes, you're giving private doctors guidelines, but private doctors may have different practices. Some will just take a look and then issue the certificate. And then we have so many healthcare centers. Don't ask people to go to clinics. If they go to jockey club clinics, then they will overburden the clinics. But we have district health centers. Can these centers provide a service at a standard rate, say $200 or $300? So it's a cheap price, and then people can get the examination because there are so many district health centers, they don't have enough work to do. So it's good they could provide a service, and this will be a standard service for drivers and the public. This is protection for them. So I'm just making this suggestion for your consideration. Thank you.
Commissioner, please. Thank you, Mr. Chan, for your suggestion. First, I would like to thank you for your support for a proposal that is to protect road drivers and users as well as pedestrians. As for our intention, this proposal is not to stop aged drivers from driving commercial vehicles. Some people may use driving as a way to pass time. We want to cultivate this habit of taking medical examination for early detection of health problems, such that aged drivers can treat their diseases earlier on. There are a lot of common geriatric diseases. If people take medicine early, then they can handle or curb their diseases early. For eyesight or hearing problems, we need to have them handled or detect these kind of issues early. As for the district health center suggestion, we will look into that if we can have people take medical examinations at these centers. Next, Mr. Lee. The health conditions of drivers is essential to road safety. For this proposal submitted by the administration, we support it in principle, but we have some concerns. On medical examination fees, a lot of drivers are worried if it will be very expensive, and they would like the government to provide subsidy. If the government is to provide subsidy, well, because now you will rely on the private doctors to provide such medical examinations, will there be cases of abuse? If we are relying on private medical practitioners to provide medical examinations, why don't we ask people to have their checkups at the district health centers or public hospitals? Because this is a proposal submitted by the government. Second thing, on the monitoring mechanism. There are a lot of medical examinations that were not handled seriously. I think we are all aware of the situation with the medical certificates. How do we prevent the same thing from happening as with the case of taking medical certificates? Does the administration have any way to monitor the process? Thank you. The few comments that you proposed will be taken up seriously. First, we want the fee for medical examination to be kept to a reasonable level. I think that people have a responsibility to take care of their own health conditions, regardless of whether they are commercial vehicle drivers, because it does not only affect your own health, but the safety of the pedestrians on the road. I think that people should be responsible in this respect. As for the level of medical examination fees, when people are worried if we have such requirement, will the level of fees be higher? This is what we're concerned about as well. We have colleagues from hospital authority, for example, in our panel, and we have considered whether we can provide such examinations under the public hospital system, but we have limited resources. So initially, we plan to have private doctors conduct these medical examinations, but quality control is very important. With the consultant team and expert panel, we received their advice and that we will set out the guidelines very clearly to ensure the quality. And we have also incorporated a clause asking the applicant for driving license to make a declaration on their own health conditions. So after the doctor has made the assessment, they will have to take up their own responsibility as well for self-declaration, because if a person is not 100% honest with the doctors, sometimes not all diseases can be discovered by the doctors. So the applicant will have to take up a responsibility such that we can seek. It will serve a deterrent effect. As I've said, first, people have a responsibility to take care of their own health. Second, this is a recurrent expenditure of the government. We have to take care of the issue very carefully. Next, Mr. Michael Tian. Thank you. We, as the round table, think that the medical examination for every 10 years for commercial vehicles without clarity on the examination items or guidelines, we think that this is an not ideal situation, and we support the proposed amendment from the administration. I have a few questions. First, when the commissioner received suspected cases reported, currently we will have to wait until the driver apply for renewal before we can process the case. In the future, the commissioner will be empowered to ask for medical examination. So whenever the commissioner receives reports of suspected cases, you can ask the driver to conduct medical examination. We have to think if there will be cases of abuse. For example, if a driver is rude and the passenger just report the driver being in poor health conditions. So I think that you have to set out the level of evidence that have to be submitted to support the report and ask the complainant to sign off their complaint forms. Second, there are some drugs that do not affect the driving capacity. There are some drugs that the chronic illness patients have to take, and it may affect the driving capability of the drivers. I think this is not discussed in the papers. Third, have you taken into account the cost of medical examination? If we provide 100% subsidy for drivers aged between 65 to 70 to conduct medical examination every year, how much money will be involved? Another thing, how long will the medical examination take under your new arrangement? Lastly, I would like to talk about this. There are compulsory retirement age for commercial drivers. For example, in the mainland is 65. In Singapore is 70. Will you draw a line? Say, if a driver will be allowed to drive after they're 80 or 70, and they will have to have a ceiling that they can drive per day to set a maximum driving hours. Please allow time for Commissioner to respond. Thank you. I will give a quick response. First, thank you for your support. If there is report on the poor health conditions of a driver, we may exercise the power to revoke or suspend the driving license of a driver's. It's not as simple as you said. There are a lot of reports given from the police, hospital authorities, or government departments. There are a lot of cases that cannot be processed under the current legislation. When we receive reports from citizens, instead, they have to be done in real name with detailed information before we exercise our power, so we will not be harassing drivers regardlessly. Commissioner, because Mr. Tian asked a lot of questions, including subsidy, maximum working hours, and retirement, maybe you will have to give a written response. Perhaps I will see if similar questions will be raised by other members. Next, Mr. Look. Thank you. Zero accident is very important in terms of traffic accident. So there is a reasonable requirement for the physical fitness of the drivers. Why are commercial drivers so worried about this amendment? At 10 a.m. today, outside the central government offices, there is a group of drivers, commercial drivers, asking the government to balance the interests of the trade. There is insufficient retirement protection system in Hong Kong. There is low MPF fund, and we have no strong retirement protection system. A lot of people have to work beyond the age of 60 or 65. I would like to commend the drivers who drive beyond their retirement age. In the process of improving the legislation, we have to be careful. There are a few points that I'm concerned about on medical guidelines. For the list of diseases, for example, hypertension, sudden attacks of disabling giddiness or fainting. What is the definition? How serious should the hypertension be for it to cause such effect? For diabetes, some people contract such disease in their middle ages. So what does uncontrolled diabetes mellitus mean? Would it be okay if I'm taking medicine for the disease? I hope that there can be clearer guidelines to alleviate the worries of the trade. Some drivers were crying outside the central government offices because they are worried and they want to continue to serve the public. It includes drivers of school buses and taxis, etc. I hope that there will be subsidy. Commissioners say that they are worried about abuse. For serving drivers, they will not be abusing the system because the medical examination takes time. More importantly, I think the administration should communicate with the trade. Thank you. We will definitely communicate with the trade. We hear your comments and views. And I would like to clarify that we are not using this project to stop aged drivers from working. Instead, we want to cultivate habits of having medical examinations if they have hypertension or diabetes. We are targeting uncontrolled disease. Now, the medical technology is advanced. If they conduct regular checkup, then their conditions will be under control. I believe that they will not be affected very seriously. As for the age limit, there is a need for aged drivers to continue working. That is why we do not put a age cap on the drivers. Next, Dr. Lam. Thank you. I am not a member of the panel. Early detection can allow drivers to drive for a longer time. I have conducted a number of medical examinations for applicants for driving license. As for the current medical examination certificate, I think that is rather simple. We know chronic illnesses are more prevalent in Hong Kong. If the drivers are contracted with the 8 diseases set out by the government, then it will affect road safety. With the new guidelines, we think that the medical examination will be more standardized. With the aging population in Hong Kong, promotion of primary health care, family doctors is very important. So the family doctors will know about the conditions of the person, and I think that is more appropriate for the family doctor to assess the conditions of the patient. I know that there will be a primary healthcare system in place. As for the age, 60 is considered young in Hong Kong. When we have more statistics in place, maybe younger drivers will consider having medical examinations as well. As for hearing and visual tests, of course, doctors can conduct these tests. When cases are controversial, I think that our specialist colleagues can help as well. Thank you. I would like to thank Dr. Lam for his suggestion. We agree that the primary healthcare register and system can help a lot of doctors in knowing their patients. So when the family doctors are more familiar with the patients, they can have a better medical assessment. As for drivers aged 60 to 65, we have to take this issue very seriously, because for the validity of full driving license for drivers aged between 65 to 70, now we give an option of 3 years. Most people actually will choose the validity period of 3 years. As for the subsidy level, due to the aging population currently, the number of full driving license holder aged 65 above, it accounts for about 49% of the total number of driving license holders. So what we mean by 60 or above, it includes drivers aged 65 or 70. So we have over 40,000 drivers that are aged 75 or above. We've heard from the Federation, and they ask if there can be subsidy. We will take that into account cautiously. Thank you.
周小松議員。
Mr. Charles Siu Chung, thank you. We want to promote road safety, so the government is proposing to tighten the requirements for aged drivers to take medical examination, and I support that as a general direction. But then I must convey the views of relevant groups. There is concern about lowering the threshold to 65 years of age. Now, we can all see there are still many drivers aged 65 or above still working as drivers. Now, if there is a more stringent physical fitness requirement, will it affect their job as drivers? That's the first concern. And secondly, if there's going to be annual examination for the age group of 65 to 71, we see that actually most people in this group are still very healthy. So is it really necessary to have annual examinations? I hope the government will consider that further. Now, I glad to hear what Mr. Chan Hock Fong suggested. Can we relax the requirement a bit for this age group? I would suggest examination every 3 years for this age group, and then it won't cause so much distress to the reference drivers because for those aged between 65 and 70, they usually still in relatively good health. As for subsidy for the examination fees, I think the government should really consider it. They should consider subsidizing the examination fees of professional drivers. Thank you. For the age groups 65 to 70, shall we have examinations once a year? Yes, we've heard your views. I'm sure we will be receiving more views from the sector when we consult them, so we'll see what the impact is. Second point about the fees, let me dwell on the principle. We don't want the examination fees to be too high. There shouldn't be a high fee actually for this type of medical examination. And if the fee is not high, then for the aged, especially the aged drivers, if they get into the habit of an annual examination, it's good for them. Then they could monitor their health. It's good for their health. It will also give assurance to their family members. That's why we believe they have the duty to look after their own health. Now, if the examination fees will be high and not so affordable, then we will consider whether there is need for subsidy, and that will be a stronger case actually. So we have to wait till the guidelines are out, and we have the fees levels are set before we have a clear idea, and then we could discuss whether there's need for subsidy. Dr. Loy Kwok. Thank you, Mr. Chairman. Now, for drivers, in particular commercial drivers, and we have to, their health conditions are of course important to road safety and the safety of other road users. Now, you mentioned some made suggestion just now. For those aged 65 these days, they are still very healthy. So should it be examination every year or every 2 years or even 3 years? Would that be sufficient? And would it be more pragmatic that way? Well, I won't dwell on that point further, as others have already spoken on that. Now, I'd like to share with you the experience of replacing my driving license on the mainland. Now, because of the pandemic, many have seen their mainland driving licenses expired, but of course they could still renew the licenses even after expiry. And for us to renew licenses, there we need to do a medical examination. There is this a machine that's like a photo booth, an instant photo booth. So there is an instant photo function. There's also a medical examination function. And the examination covers the items that the Commissioner mentioned, because when it comes to driving safety, it's all about eyesight, hearing, the coordination of the limbs, and on the mainland, they also check for color blindness. So that's a very interesting process. And then there are doctors stationed at the center. If you don't use that machine, then you could go for manual medical examination covering the same items. I wonder if you have in mind using such new technology to replace manual examination. Now, from my experience, I find it rather interesting. It's actually very practical. The cost, of course, will be relatively lower. And in fact, the fees for for renewing license covers the medical examination, and the examination is done on the spot at the driving license center. So on the mainland, they are using such technology, and in Hong Kong, perhaps you could do the same. So you could provide a service, and people will have to take the examination before they actually renew their license at the same place. And it will help to save manpower and cost, so I hope you will consider it. So I hope you consider the application of new technology. Of course, there's need to step up management on such matters, but then you mustn't cause panic to commercial drivers thinking they'll lose their jobs. And even from non-commercial drivers, I hope it won't become some sort of a nuisance to them. While the Transport Department has been sparing no effort in the application of new technology, if there could be machine examination, definitely we'll be happy to adopt such technology. Now, my Assistant Commissioner explained the examination items to you, and they cover certain diseases. And so maybe to some extent there is need for physical examination. But then there are other standardized examination items. Perhaps we could use technology. Certainly we'll consider it. As for aged drivers, is that a livelihood consideration? Definitely, that's the case. Now, we don't want to render aged drivers no longer eligible to drive for a living through this scheme. That's not really our intention. Mr. Frankie Yik, well, I'm sure we're all aware of the concerns of the community. The sector that I represent is the sector affected, and they would like me to convey their views to you. First of all, you did not consult them beforehand, and they have expressed dissatisfaction. You should have talked to them first and learn about their concerns. Now, the biggest concern now is there are insufficient drivers. If you have this mandatory requirement, it will actually worsen the shortage of drivers, and that will in turn affect service to the public. So that's why they've come up with concrete suggestions. Firstly, as some members have suggested, now you're lowering the age threshold from 70 to 65. So what about examination at 65 and then another one at 68, and then when people reach 70, then they will go back to the original system. So I think you could consider that. That's the first point. Secondly, taxi drivers. Well, the failure rate for taxi license driving test is high. And failure rate is high for road tests. Now, applicants for taxi licenses already drivers. They, as long as they know all the traffic rules and they know all the signs, that's fine enough. There's really no need to do road tests because people can use navigation tools like GPS. So you should review your system. And then one reason why taxi drivers are in shortage because of the income level. So they have submitted an application for fare increase. We hope you will deal with it. They hope that you will deal with it as soon as possible because some officials have told them to wait. It won't be soon that this application will be considered, but I hope you'll go by the established mechanism in considering the applications. Third point, now the sector has asked many times for a exclusive lane for public transport, not just bus only lane. They have such lanes. There are such lanes overseas, and if you have some dedicated lanes for public transport, it will help taxi drivers to do more trips and improve their income. And fourthly, can there be subsidy? That's also their concern. Thank Commissioner. Mr. Yik, I must clarify that we're here today to discuss with you the proposal that we're going to come up with, and this is not yet determined. So that's why we're coming to this council first, and then next we will talk to the sectors at length. So there's no need to be worried. It's not that we haven't done any consultation before that, but rather the expert panel has come up with the recommendations in end March, and we've come up with this paper, and we would like to first consult the council. Now, some members have suggested doing examinations at 68 instead of every year. So yes, we will consider such views. And of course, we'll consider together with other suggestions of doing examinations every 2 years instead of one, and so on. And then as for fare increase or dedicated public transport lane, they are not within the scope of our discussion today. For fare increase application, there is an established mechanism to deal with it. As for road test for taxi drivers. We've actually relaxed the requirements. Now, from my own experience in taking taxis, yes, many may have GPS tools, but then there was this experience of mine from Wan Chai to North Point. I actually had to tell the driver at every junction as to how he could get on to the Eastern Harbour Crossing and then get to North Point. Now, as the commissioner, I think that's not desirable. That's why we want there to be better service. So I believe, therefore, there is a need for road tests.
Chair, please allow me to add one thing. I came across the same problem when I was heading east. Chair, it's reasonable for Mr. Ik not to know the route, but the taxi drivers are professional. Next, Mr. Yu. Thank you. For this review on the requirements, I support the direction because we have to protect road users, passengers, and the drivers themselves. And for the direction of having physical fitness certification or examination, I support the direction. I share Mr. Yik's worry. There is insufficient drivers in the tourism industry. If we have such stringent medical examination with cost involved, some drivers may choose not to renew their licenses. So it worsens this manpower shortage in the commercial driver trade. For drivers aged between 65 to 70, can you ask them to just conduct 3 medical examinations between 65 to 70? I hope that the administration can consider it. As for subsidy, I think that this is essential. Currently, for commercial drivers, when we have insufficient commercial drivers and we pose so many stringent requirements on them, if their employers do not support them in this regard, then they may just give up being commercial drivers. I hope that the administration can consider providing subsidy for commercial drivers who are employees. Thank you. I am familiar with the tourism trade, and I understand that there is serious manpower shortage in the commercial drivers in the tourism trade. There are a large number of passengers for a driver of coaches, and the size of the vehicle is large. When there is traffic accident involving such coaches, then it poses huge impact to the road conditions and the passengers. So I particularly concerned about the health conditions of these drivers. And these coach drivers usually drive for long hours, and they just get off late work at a very late hours at the night. So I concern particularly about the health conditions of these drivers. As for the issue of annual medical examination, I hear you. I will consider it. We concern about subsidy level. Under the shortage of manpower in the trade, I understand that a lot of employers are trying to enhance the attractiveness of their trade, including increasing the salary, improving the working conditions and welfare. To allow drivers to work with healthy conditions, this is a good thing for the employers because this also reduces traffic accidents. And it also reduces the cost of operations. These will be our considerations. Thank you. Chair, I have 30 seconds left. I thank you for concerning about the tourism trade drivers. There is low traffic accident rate for private car drivers and coach drivers. As for the insufficient drivers for coaches, for cross-boundary coach drivers, aged above 60. I think that this is something that we have to concern about as well. Next, Mr. Chang. There is aging drivers population to ensure the safety of the road users. I support the 6 proposals of the administration. I understand that the health conditions of the drivers is vital to the safety of the road. Commercial drivers drive for long hours, and there is a higher risk of traffic accidents. So to have a more stringent physical fitness requirements on the commercial drivers, I think that this is reasonable and understandable. A lot of members ask about the age threshold and physical fitness. I would like to talk about the medical examination certificate. The certificate will have to be filled out by registered medical practitioners who will assess the applicants' health conditions, whether they are eligible to drive. Some drivers told me that the medical examination was conducted carelessly or not very seriously, and the doctors will take into account the conditions of the patients, and the patients of chronic illness will have to take medicine regularly. After the medical examination, the patients may not take medication regularly and result in traffic accident. This may not be fair for the doctors. Sometimes doctors prescribe or issue medical certificates recklessly and hastily. Is there any mechanism to monitor the situation? Another question regarding paragraph 16 on the requirements of visual acuity and visual field. Now you will introduce this Snellen chart and confrontational test. I think just by reading the paper, people don't understand the requirements. Is the comprehensive medical examination provided by private clinics enough or sufficient to cover these areas? And will there be over demand for such services? Thank you. Even when a person has conducted comprehensive medical examination, the person may still develop or have their chronic illnesses worsened. The doctors will conduct a clinical examination, and apart from this, we will also ask the applicant for driving license to declare their own health conditions. There are some diseases that they know about themselves having, and they may not be detected just by looking at the patient. So when the applicant is issued with the driving license, maybe in half a year or a year, the drivers may contract other diseases which result in traffic accident. But as with the practice today, the law enforcement agencies will investigate the case carefully and to see whose responsibility it is for the traffic accident to happen. As for the expert panel, we have representatives from the ophthalmologists. These medical examinations can be conducted with simple devices that can be done in regular clinics. Thank you. Mr. Lau. I look forward to the commissioner coming to our federation to talk to our colleagues about this proposal. People concerned about the health conditions of the commercial drivers because it affects people's safety on the road. I am completely aware that the government is helping the people with this proposal, but I have some suggestions. Now the age threshold is lowered to 65 from 70. During these 5 years between 65 to 70, these group of drivers are rather healthy, can you ask them to just conduct one medical examination during these 5 years? When traffic accidents happen with these drivers, only then will they be compulsorily asked to conduct medical examination. Now, the working conditions of the commercial vehicles, drivers, I think that this is important. Now, under the Health Bureau, there are a lot of district health centers. Can we ask the drivers to participate in the health activities under the DXC? And if they participate in 2 of the activities under these health centers, then you award them with some points. This will also encourage them to look after their health, because they're looking after their health will be a good thing for the road safety in general. Now, another member also mentioned about applying for driving license on the mainland, and we have a device for that in the mainland. In the future, will the administration work with the Health Bureau to assign a dedicated doctor to conduct medical examinations with a concession? Because this also helps to monitor the quality of the drivers. I hope that the administration can consider my suggestions. Thank you. I also look forward to discussing the item with the Federation. I value your comments so we can hear from both sides. Just now, a lot of members asked about the frequency of the medical examination. I will not repeat my answers. As for the district health centers or the primary healthcare services, how do they help with the issue? I think that this is a great suggestion. The government attaches great importance to the primary healthcare services. Professor Peng is a member of our expert panel. As for the concrete implementation, we will look into that. As for dedicated doctors, if we can assign some doctors to conduct medical examinations, we will look into that and consider it. Thank you. I would like to ask about Annex 9. We have figures on traffic accidents. Sometimes it's not the fault of the public light bus drivers. Maybe their minibus was crashed into by other vehicles. So can we have more figures as to the cause of the traffic accidents involving public light bus drivers? Thank you. Next, Mr. Lee. After handing the vehicles to the commercial drivers by the employees, actually the passengers also put their lives at the hand of these drivers. So I agree with the amendment to the requirements of physical fitness certification. Will another problem arise? That is the insufficient manpower in the trade. Will there be people who are unable to obtain their driving license under such stringent requirements, such that it worsens the manpower shortage that we have currently? Second, if a driver thinks that they may not pass the test or medical examination, for the third-party liability insurance, will it become more expensive? Have your consultant team or expert panel look into the issue? Because the age threshold is reduced from 70 to 65, will the insurance policy be more expensive? I would like to know about this. Third, the papers focus on large-scale commercial vehicles. Is the small commercial vehicle included in the requirements? Thank Thank you. Commissioner, please. Will this affect the manpower in the trade if some drivers cannot pass the examination? Well, 65-year-old drivers are rather healthy and young. There is little possibility for this group of drivers not passing medical examination. That is why so many members suggest having medical examination every few years or every 5 years. So I think that we have a grasp on the health conditions of people aged between 65 to 70. Under such situation, I think that it will not heavily affect the manpower situation. Is it the case that if you fail one medical examination, you will never be issued with a driving license again? For geriatric diseases, if the person take regular medication and then they pass the medical examination later on, they can apply for a driving license again. So we will not limit the number of applications for driving license. If a person does not renew their driving license for 3 years, they will have to take the test again. If there are medical illnesses that they cannot cure in 3 years, maybe they have to continue treatment or look into it seriously. As for the other issue, with a stringent medical examination for drivers aged 65 or above, when the insurers have a concrete grasp of the conditions of the drivers, it may not result in a more expensive insurance policy. The insurers will also look into the driving history and the class of vehicles that the drivers are driving. Thank you. Chair, I would like the Commissioner to look into the problem of manpower shortage and take that into account. Thank you. Next, Mr. Gary Zhang. I support the amendment. This is a persistent problem. The government is tackling this issue very pragmatically and positively. This paper is very detailed. There are strong reasons and grounds with detailed statistics. I would like to ask about some figures in this paper because in paragraph 11 and 15, some members also asked about this. For serious and fatal traffic accidents, is the involvement of aged drivers higher in these traffic accidents? What is the comparison between the private car drivers or the commercial vehicles drivers? For commercial aged drivers, is 16.6 per 1,000 people or drivers. What is the comparison between aged and young drivers? Are the accidents involving aged drivers higher in number? Now the Commissioner of Transport is empowered to ask the drivers to submit their medical examination certificate, and if they refuse to submit such certificate after involving in traffic accident, they will have their driving license suspended or revoked. Under what circumstances will the driving license be revoked? And what is the time allowed for the drivers to submit their medical examination certificate? Because if you allow them maybe 6 months to submit the medical examination certificate during this period, there may be danger involved. Thank you.
Commissioner. Thank you, Mr. Chairman. Thank you, Mr. Zhang, for your support and encouragement. Now, as we consider the age driver issue, we have actually made reference to a large body of traffic safety data. Now, we look at serious and fatal traffic accidents involving aged drivers. We could provide you with concrete figures later. But I've looked at the figures, and my impression is that it's not necessarily the case that aged drivers are involved in more accidents. But when aged drivers are involved in accidents, then these accidents are usually more serious or even fatal. And usually the aged drivers themselves are either injured or even killed. Of course, there are other cases when aged drivers may crash into pedestrians and other cars, leading to serious consequences. So we need to deal with that situation. Now, do we see similar situation with other age groups? I will look at the data again, but every 3 months I will look at figures together with my colleagues on traffic accidents involving different vehicle types and so on. So apart from age, we also look at the involvement of different vehicle types. We see that for taxis and public light buses, and bicycles also, but of course bicycle is not within the scope of our discussion today. But for the traffic accident rate per 100 kilometers is relatively higher actually for the 2 vehicle types. And then for commercial vehicles, of course, there is a high number of traffic accidents involving commercial vehicles because commercial vehicles are always on the road. But then for the traffic accident rate per 100 kilometers, the rate is also relatively higher compared to other groups. We can share all this information with you, Mr. Zhang. Thank you. I'm going to speak before I'm the last before I draw the line, and there are 2 other members who wish to speak after I've drawn the line, and then Mr. Tan wants to speak for a second time. So I will give Mr. Tan Ka-pil, Mr. Yim Kong 2 minutes each, and Mr. Michael Tan wishes to speak for a second time. Well, we don't have a second round, so I won't allow him to speak for us in a second round, but I will perhaps allow some of his questions to be answered using time in my round because he asked some rather good questions. Let me first give my own views. First, I'd like to thank the administration for submitting this paper, which is the review outcome. So as soon as the review outcome is ready, you come to first consult us, and then you're going to consult the community and different sectors. It's not as if you are not sharing your review outcome before you make a decision. So I welcome this approach of yours. And then for aged drivers, we can see a rapid increase in the number of such drivers. And then aged drivers are getting older too. Now, the reason why there are more older age drivers because there's an increase in the number of age drivers as a whole. But then age drivers don't mean that they are not safe drivers, just as young drivers are not necessarily safer drivers than age drivers. So that's something we need to consider today. I agree we should have specified medical practitioners during the examination. If they just go to any doctor for an examination, then the standards may not be aligned. Mr. Chan Hak-fung suggested asking district health centers to provide the service. I think that's a good suggestion. And the second issue is about the frequency of examinations. Is it the case that for those aged between 65 and 70, there has to be annual examination? Please consider our view, see if there's room for relaxation. And then Mr. Michael Tan asked some questions too. The administration hasn't yet responded to those points. Perhaps I'll ask the administration to respond to those points. First, about driving under the influence of drugs, and then secondly, the restrictions on working hours for aged drivers, and so on. Thank you. Commissioner? Well, yes, we totally agree. It's not the case that because driver is aged, he's not driving safely. Now, but just that and also as we know, there is an aging population, so there's also an increase in number of aged drivers, and that's why we want them to get into the good habit of having regular medical examinations, so they could detect any issues early and seek treatment early. Now, whether we're going to impose a requirement on maximum working hours for drivers above a certain age. Well, this is a suggestion of Mr. Michael Tan. Will consider it. As for taxis and truck drivers, also there are drivers who hire a vehicle, and then so how do we then dictate maximum working hours, and how can we make sure there is fair law enforcement? Well, this is something we have to study very carefully. On the discipline of doctors, how do we make sure that doctors will not arbitrarily issue or indiscriminately issue examination certificates? Well, we'll see whether we are going to set up a register for medical doctors, and we'll see how much details include in the guidelines for doctors. Now, of course, doctors are professionals. They have their own professional code of conduct, and if they breach that code, there are penalties involved. As for driving under the influence of drugs, now, if drugs are used for controlling chronic illnesses, the drugs should not affect someone's driving, and doctors should not prescribe such drugs to commercial drivers. Mr. Tangapil, 2 minutes. Thank you. Two issues. One, Uber or illegal or for cars taking passengers, charging a fare illegally, and how hard the government will crack down on such activities, we'll wait and see. But here we are talking about tightening the requirements for physical fitness census and so on. And so there are public like bus drivers who say, well, it's so much trouble, I'll just become an Uber driver instead. So you're not actually addressing the issue, and actually you're going to cause more unfairness. I wonder if you've made an assessment on that. Second point. Now, there are these new requirements for drivers. Maybe drivers no need to pay for the fees as long as there's proof that they're under employment, say, of a taxi company. Then the fee will be charged directly to the employees or whatever, or even waived. Now, of course, our discussion today is not about how we crack down on Uber activities. But of course, we know that there are different views about people, illegal faring of passengers, charging a fare. We are determined to crack down on such behavior, on such activities. And today, here we're talking about commercial drivers. And we're not just talking about drivers who carry passengers at a fee, but we're also talking about heavy truck drivers and public light bus drivers and so on. Now, can we ask employers to provide employment proof, and then the government will pay fully for the examination fees? Well, I've already given responses to that to previous questions, but still we believe the public have a duty to look after their own health. Mr. Yim Kong, I support the review proposals. Every country takes road safety very seriously. In Hong Kong, in the past few years, we've seen a number of serious accidents involving aged drivers. Because they drive too slowly, they actually cause accidents at the end. And recently, there's a case involving a taxi driver aged 80, and that's sparked widespread public concern. Now, there are many people aged 65 are considered just young elderlies. They're still in good health. But then for those aged 80 or above, and if they're still allowed to drive public transport vehicles, I have great reservation on that. Of course, we have age discrimination legislation, so there is not a statutory retirement age. But then we are talking about safety. So would the department consider for commercial vehicle drivers, you will propose a maximum age limit based on the general health conditions of the relevant age groups. Thank you. Well, at this point, we don't have any proposals to impose a maximum age limit for commercial drivers or drivers in general. But then we see, of course, in some places, they may impose requirements for road tests or driving tests for those at advanced age, because it's about testing their response to different road conditions. Because when people get to a certain age, maybe their response will slow down. So we don't rule out that possibility. We'll see whether we will introduce such tests for people at a very old age. And if they could pass the test, of course, they could continue to drive. If not, then maybe we need to do something. Thank you.
多謝
Thank you. We end this agenda item. We will discuss the next item, northbound travel for Hong Kong vehicles. We invite the officials to enter the room. Before we start, I would like to remind members that according to Rule 83A of the Rule of Procedures, if members have any direct or indirect pecuniary interest regarding the discussion item today, they will have to disclose the nature of that interest before they speak. Now, would the administration representative come in? If you would like to put questions, please press the button now. Now, would the government representatives please enter the room? Thank you. When the administration of representatives are ready, then we will start. We have no PowerPoint presentation today. I will ask the administration to walk us through the papers, and then I will allow members to ask questions. Mr. Mack, please. Thank you. Thank you, Chair and members. Guangdong and Hong Kong governments have announced on the 1st of May the arrangement for northbound travel for Hong Kong vehicles. On the 1st of June, we will accept application. On the 1st of July, we will allow approved drivers to travel between Hong Kong and Guangdong provinces by using the Hong Kong-Zhuhai-Macau Bridge. I will walk you through the details of the northbound travel for Hong Kong vehicles. The scheme allows eligible Hong Kong private drivers to travel between Hong Kong and Guangdong via the Hong Kong-Zhuhai-Macau Bridge without the need to obtain regular quotas. It facilitates Hong Kong residents self-driving to Guangdong for business, visiting families, or sightseeing on a short-term basis, further making good use of the Hong Kong-Zhuhai-Macau Bridge and promoting the development of the Guangdong-Hong Kong-Macau Greater Bay Area. About 450,000 eligible Hong Kong private cars are expected to be benefited. The Hong Kong government sincerely grateful for the staunch support of the central government and the Guangdong provincial government for the northbound travel for Hong Kong vehicles. Now, under this arrangement, we will have a customs guarantee-free policy for eligible Hong Kong private cars under this scheme. The drivers will not have to pay customs duties or apply for guarantee arrangements with the mainland customs, thereby streamlining the application procedures and lowering the handling fees. The administrative measures have also been promulgated with the detailed requirements for the drivers' applicants. It details the procedures for vehicle examination and application, as well as booking. The details are set out in the papers. These procedures include submitting an online application, including applying for a closed road permit with the Transport Department. Second, application for joint approval. The applicant will have to go to a dedicated vehicle examination center, and they will have to purchase motor vehicles insurance. Third, after getting the permit, the applicant can reserve for a specified travel time on the website. For the vehicles traveling between Hong Kong and Guangdong provinces, they will have to take out traffic accident liability insurance. We will have a one-stop arrangement for it. Drivers can buy the compulsory traffic accident liability insurance for motor vehicles or purchase this unilateral recognition insurance. So they can buy insurance that is under the unilateral recognition scheme with the Hong Kong insurers. So it will also cover the compulsory traffic accident liability insurance on the mainland. So the entire policy will be taken up by a single insurer in Hong Kong, so they will not have to purchase two insurance policies. As for publicity, the Transport Department has established a website for the northbound travel for Hong Kong vehicles and included frequently asked questions. For interested applicants, we will also inform them of the points to note when driving in mainland, and we also remind them to obtain direct issue of mainland driving licenses in the mainland in advance and to get familiarized with the driving regulations and conditions in the mainland. We will work on promoting the scheme and disseminating the relevant information. Instructional videos on application procedures will also be available for public references. We will explore setting up a land-based boundary control point such that people can travel to and from both the western and eastern parts of Guangdong. We're happy to take questions from members. Thank you. Chen Xiu-hong, Holden Chow, Dennis Len, Lo Wai Kwok, Stanley Lee, Chen Hock Fong, Frankie Yik, Michael Tian, Yu Pak Lan, and Chen Han Pen. 4 minutes. Question and answers included. Mr. Chen, please. Thank you. Northbound travel for Hong Kong vehicle scheme allow drivers to travel between Hong Kong and Guangdong provinces. I fully support this proposal. Here, I would like to thank the Guangdong provincial government for implementing this policy and scheme to benefit the Hong Kong drivers, such that Hong Kong people can drive to Guangdong for business, visit families, or sightseeing. And this also facilitates the idea of 1 hour cycle in the Greater Bay Area. As mentioned in the paragraph 18 of the papers, the government will explore extending the scheme to a Hong Kong-Shenzhen land-based boundary control point such that Hong Kong private car drivers can travel to and from both the eastern and western parts of Guangdong without having to apply for regular quotas. I would like to ask about the maximum number of vehicles allowed for this scheme. Now, the Hong Kong and Guangdong governments are discussing the maximum number allowed for the scheme. Do you have concrete figures on the maximum number of vehicles allowed in the scheme? The northbound travel for Hong Kong vehicles will be implemented and will start on the 1st of July. I would also like to ask about the vehicle examination. In paragraph 18 of the papers, the applicant will have to drive their vehicles to the dedicated vehicle examination center. In paragraph 10, it says out that drivers will have to drive their cars to China Inspection Company Limited. What is the capability of this vehicle examination company? Because there is long queue for vehicle examination even today. According to paragraph 8, so on the 200 applications will be handled per working day in the first week, and then 300 applications will be handled per working day from the second week. And the government says that they will increase the number of applications to be processed progressively. With such a large number of applications, how will the Vehicle Examination Center handle such huge demand after the implementation of the northbound travel for Hong Kong vehicles? Thank you. I'd like to thank Mr. Chen for supporting our proposal. On the maximum number of vehicles allowed under the scheme, we are discussing with the Guangdong provincial government. We try to allow more vehicles to be allowed to travel between Hong Kong and Guangdong under the scheme. But we have to take into account the capacity of the boundary points on both Hong Kong and Guangdong sides. Since mid-June, we will allow people to book for their specified travel period. So before mid-June, we will announce the maximum number of vehicles allowed under the scheme per day. As for the vehicle examination issue, we've been in close liaison with the Guangdong province and the China Inspection Company Limited. In Yunlong, they will have extra vehicle examination spots for vehicles under this scheme. We will continue to monitor the usage and to increase the number allowed for the traveling between the Hong Kong and Guangdong under the scheme. Next, Mr. Holden Chow. Thank you. Northbound travel for Hong Kong vehicles can facilitate Hong Kong drivers to make good use of the Hong Kong-Zhuhai-Macau Bridge. I would like to thank the Guangdong provincial government and the Hong Kong government for working on this project. Now, I would like to ask about the arrangement concerning the China Inspection Company Limited, because there is long queue for vehicle examination with this company. With the implementation of this northbound travel, I expect the demand to be increased progressively. Now, the administration says that they will increase the quotas for vehicle examinations. I do support that. We do need more resources for drivers to fulfill such vehicle examination requirements. Will you think about ways to process applications or urgent applications for drivers who need to travel on the same day? Because for online purchase of insurance policy is simple, but whether or not the drivers can complete their vehicle examination before their travel date is doubtful. It also depends on the manpower with the vehicle examination center. Thank you. Thank you, Chair. And Mr. Chow. As mentioned, China Inspection Company Limited will increase the number of quotas for vehicle examination. I would like to talk about the procedures. So first, the vehicle owner will have to apply for the Hong Kong and Guangdong governments. They can do it online with the thematic website. Next, they will have to do vehicle examination with their vehicles, and then they will have to purchase insurance. After approval by the mainland counterparts, then in the specified travel period, they can travel between Hong Kong and Guangdong. The period lasts 1 year. It depends on the period covered by the insurance. Within that year, the driver or applicant can book for a travel period, so they will not have to conduct vehicle examination before their every trip. So the problem raised by the member just now will not appear. Thank you. Next, Mr. Leung. Thank you. Yesterday, the Zhuhai mayor came to Hong Kong and met with our chief executive to talk about this northbound travel for Hong Kong vehicles and other issues. I met with the mayor yesterday and exchanged views with him too. Now, the target is that there will be about 450,000 eligible Hong Kong private cars to be benefited. if we have to process this large number of drivers, then we need 1,500 people to handle, taking 6.25 years. How do we enhance efficiency? Another issue about direct issuance of driving license from the mainland. Can we set up agents in Hong Kong to handle such issue, such that we can enhance efficiency and effectiveness, etc.? Now, the driver will be approved for traveling for 1 year, but there is a limit of no more than 180 days within a year in aggregate and 30 consecutive days upon each entry to the mainland. If there is such restrictions in place, it may not fulfill their travel needs. For people who are starting business in the mainland, should we relax the restrictions or upper limit of 30 consecutive days for them? Now, on the bridge fares, for private cars is $150. Can we reconsider the fare to encourage Hong Kong drivers to travel to mainland more often, to encourage business? Maybe we can reduce the fare for the bridge, and when there is higher traffic flow, then we increase the fare after that. Thank you. Mr. Mack. Thank you, Chairman and Member. Member has raised a lot of valuable points. Now I talk about the number of vehicles. We expect that 450,000 eligible Hong Kong drivers will be benefited. These vehicles will be privately owned. So these are the number of cars that will potentially be able to benefit. We encourage drivers to use the scheme because it encourages interaction within the Greater Bay Area. For the scheme to be implemented in an orderly manner, that is why we set up this application ceiling to be processed per day. So starting from second week, we will process 300 applications per working day. When there is great demand, we may increase the number of applications to be accepted per day. We will try to meet the needs of drivers who are interested in participating in this northbound travel scheme. Hong Kong driving license owners can apply for direct issue of mainland driving license. Under prevailing policy, the Hong Kong drivers will have to get the license in the mainland. We will look into if the arrangement can be improved. This 180-day and 30-day restriction is the same as the arrangement with the mainland. We will see if we will improve on that. Sorry, with the Macau.
港珠澳大橋
Dr. Low Wai Kwok. Well, before the commissioning of the Hong Kong-Zhuhai-Macau Bridge, I told the then Secretary for Transport, Mr. Frank Chang, that if we want to make good use of the bridge, then it's best that we have early implementation of northbound travel for Hong Kong vehicles. Now, we've talked about this scheme for many years. It was long before the commissioning of the Hong Kong-Zhuhai-Macau Bridge. We already started exploring the option, and I'm glad to see that finally the scheme is in place. I can see that the SAR government and the mainland government have worked very hard to make the scheme as convenient as possible, just say in relation to insurance policy arrangement. Now for Hong Kong vehicles with mainland registration plate, people are unhappy about the insurance policy arrangement because they have to take out insurance both in Hong Kong and on the mainland. And we're talking about connect schemes these days, so can we not have a single insurance policy covering both the mainland and Hong Kong? And this is what exactly is suggested here. And so for other Hong Kong vehicles with mainland registration plate, we should also explore that possibility. Of course, when we are to drive on the mainland, we have to hold a mainland driving license. During the discussion of the last item, I shared my experience about renewing my mainland driving license at a vehicle licensing center on the mainland, and then I just need to go into a booth for medical examination. So if we are going to have connect some sort of interoperability, maybe we can just have a single license, driving license, so we could drive both on the mainland and Hong Kong, because the requirements for driving license in Hong Kong also is stringent as that on the mainland. Now, many friends were excited about this scheme. They were planning to join the scheme, but then they're disappointed because the scheme is now restricted to only private cars registered under individuals' names. But then for other vehicles that can now travel to the mainland, there is no such restriction. Well, there are actually few quota places. So we're not talking about a large number of Hong Kong vehicles going on into the mainland. So can you relax the eligibility further? So for vehicles, private vehicles registered under a company, they can also make use of this northbound travel for Hong Kong vehicle scheme. I'm talking about private cars, not commercial cars. Yes, Mr. Mac. Well, thank you, Dr. Low, for your suggestion. Also, thank you for your support for this scheme. On insurance policy arrangement, we hope this arrangement could help drivers or vehicle owners. And about waiving the test for people to obtain mainland driving license, we are trying to pursue that. We want to make the arrangement increasingly convenient. So maybe we could actually renew a license in Hong Kong in future, as suggested by the member. Or in future, we could just use our Hong Kong driving license and we can drive on the mainland. That would make things even more convenient. Now, we're going to take all this up with Guangdong authorities, but of course, it's a matter of state policy, but we will try to strive for such arrangements. As for private vehicles registered under individuals' name, that's a consensus with the Guangdong authorities. For the northbound travel for Macau vehicle scheme is also just restricted to private vehicles owned by individuals, and this is a state policy. So, but then all parties have agreed that we will review the arrangement, and then we'll see if that we could relax the eligibility to cover also private vehicles owned by companies. Mr. Stanley, well, I'm grateful to the Guangdong authorities and the SAR government for finally launching the scheme. I understand many are interested in joining the scheme. Now, I have experience driving on the mainland. The driving culture, of course, it's not the same. First, we have different they have left-hand wheel drive and we right-hand wheel drive, and also the driving attitude is not the same. Now, I'm a bit concerned that currently we don't have a notification mechanism on traffic accidents. Now, if there are more Hong Kong vehicles or drivers driving on the mainland, and how can the SL government keep tab of traffic accidents involving Hong Kong vehicles? That's the first point. Secondly, in the paper, you say you're going to do more publicity on the driving on the mainland. Yes, I've visited your website. It's done pretty well. I hope you will be producing more videos so people could get used to it, because it takes time for people to adapt to this new arrangement. But then already from the 1st of July, people can drive across the Hong Kong to Macau Bridge, and can they use e-toll, or do they have to pay tolls by Alipay or whatever? or WeChat Pay. So you need to provide such information. And third point about the compulsory traffic accident liability insurance for motor vehicles in mainland. I'm glad that you have reached an agreement with the mainland on the unilateral recognition arrangement. But what about the usual quota places for Hong Kong vehicles that can go to the mainland now, because there's a requirement for separate insurance policies. But then for this northbound vehicle travel for Hong Kong vehicles, the arrangement will be more convenient than the standing quota arrangement. So would you review that too, Mr. Bank? Well, on the difference in driving culture and the issue of left-hand drive and right-hand drive, of course, we are aware of that. Now, thank you, Ms. Lee, for visiting our thematic website. We're going to provide further information. For example, there will be instructional videos for the public to follow the application procedures and so on. And then, second point, in a community there are motor associations or other groups that offer familiarization classes. So people who are interested in joining the scheme will learn about the driving culture and the rules and regulations on the mainland in terms of driving there. As for the notification mechanism of the mainland, as we think that's very important, so that's why we have had discussion with the Guangdong authorities on such a mechanism. Right now, if there are Hong Kong residents involved in traffic accidents on the mainland resulting in injuries or fatalities, well, we have Hong Kong officers on the mainland, and then they have special team run by the immigration department to help offer assistance. And also for, say, the Guangdong office, they will provide assistance to Hong Kong residents involved in traffic accidents as necessary. So we will continue to enhance the mechanism, and when we start implementing this scheme, we will further improve the arrangements. It will make sure that it's safe and convenient to drive Hong Kong vehicles to the mainland. Perhaps I'll ask my colleague to also say a few words. Now, right now, there's the unilateral recognition arrangement. Well, this is a consensus reached with the mainland authorities in support of the northbound travel for Hong Kong vehicle scheme. So the insurance sector and authorities on both sides, of course, are happy to consider whether this unilateral recognition arrangement could be extended to other schemes or other vehicle types and other cross-boundary crossings. But of course, it will be a matter for the two governments to consider. Now, for the northbound travel for Hong Kong vehicles, we are launching for the first time the unilateral recognition policy. This is a good attempt. I believe in future we want to extend the scheme to cover other the policy to cover other schemes. I don't see a major problem there. Thank you. Mr. Chen Hock Fung, I fully support this policy because it will really facilitate our integration into the Greater Bay Area. But then there is difference in the driving culture between the two places. I agree with Mr. Stanley Lee. We need to do more publicity. But publicity alone is not enough, because when it comes to driving, it's a matter of safety. If you just ask people to visit a website and look for the information, they may choose not to do so, and at the end there may be accidents. Have you considered mandating people to watch certain videos before they will get the approval? That will ensure safety, because driving regulations in the mainland are very different than ours. For example, in Hong Kong, you're not allowed to turn right at the red light, but on the mainland, you're allowed to do so. And also, on the mainland, they have bicycles on the accessory on some of the roads, and so we Hong Kong drivers must learn about this, otherwise it's very dangerous. So maybe you should mandate Hong Kong drivers to watch certain videos before they get approval. I hope you'll consider it. Second point, What about supporting measures? For example, car parks. Can Hong Kong vehicles go into car parks because we don't have the EZ car plate? And we just have the Hong Kong car plate. Can the car parks recognize this place, or can they go into certain junctions? They may even have problems going on the highways. And what about when there are penalty tickets? How do we pay for the penalty tickets? Now, we haven't heard the arrangement for all these issues. You have to explain them. Otherwise, people may not have a nice experience driving on the mainland, and then, this is not something we want to see, because this is a good scheme. Third point, apart from the Hong Kong Macau Bridge, will you consider other cross-boundary crossings? I know you're considering it. Let's say if I want to go to Shenzhen, it's inconvenient for me to have to make this last tour to get to Shenzhen. If I'm driving an electric car, I'm not sure how long I have to charge my car before I'll finally reach Shenzhen. So could you give us more information? Thank you.
Thank you. These are the things that we and the drivers concern. We attach great importance to road safety. In terms of publicity, we will liaise with local organizations to provide classes. As for the mandatory requirements for drivers or applicants to watch videos before they can make their applications, we will consider that. As for parking spaces and highways, we have followed up on that with the Guangdong counterparts, and we have made progress. As for car park, there are car park operators that are updating their entry system. And drivers may opt out of automatic recognition, so they can enter their registration mark manually at the car park. As for highways, we discussed that as well with the mainland authorities. You can go through the manual booth to solve the problem. But then, of course, we want to make it convenient for drivers. So we are still exploring ways to facilitate Hong Kong and Macau drivers such that they have a better experience under the scheme. Thank you. Mr. Yik, thank you. One of the questions has been raised by Mr. Chen regarding car park. I have another question that I've put a number of times regarding customs duties. Now is exempted. Then what about if my car or vehicles is being stolen and I report the case to the police? How would such cases be handled? Some people are worried if they have their vehicle stolen, can they come back to Hong Kong smoothly? Next, regarding the vehicle examination with the China Inspection Company Limited, now you will provide extra 700 quotas for drivers under such scheme. Now, the mainland is concerned about the customs regarding the functions of, instead of the functions or of the vehicles. Please look into the matter. Some friends asked me, why should we join the scheme for northbound travel instead of applying for regular quotas? If I am going to the mainland just once a year, should I just apply for regular quotas? Should we combine the two schemes? Today we have this scheme. I welcome it. But as our next step, can we streamline the procedures to facilitate the drivers? Because this is what we should do. for us to integrate into the Greater Bay Area. Thank you. Mr. Lau. I agree. We try to make it convenient for drivers for the purpose of integration. Under this northbound travel scheme, this is a big step forward. And as our next step, we will improve the arrangement. As for customs duties, under the administrative measures promulgated by the Guangdong government, if a driver has his car stolen in the mainland, then the applicant and the driver will have to notify the police and the Customs and Excise Department on the mainland, and they will have to go through certain procedures under the legislation. We have talked to the Guangdong government. Well, the drivers first will have to notify the police and the Customs and Excise Department, and then they will conduct investigation. So we have communicated your worries to the Guangdong provincial government, and we will look at the situation on a case-by-case basis. As for the China Inspection Company Limited issue, they will look at the serial number of the vehicles if they are in line with the vehicle permit. Under the administrative measures, there is certain regulations as well. If a driver commits an offense on the mainland by switching their vehicles, then they may be barred from applying for northbound travel for a period of time. I hear your concern. We will continue to improve the administrative measures to facilitate drivers and make it more convenient for them. We will also have to guarantee the duties received and the vehicle situation. Now we have a scheme for self-drive to Guangdong province. Drivers can stay on the mainland for 7 days in the Greater Bay Area. They will have to take out certain insurance under that scheme, and they have to obtain a temporary permit at the boundary control points. Now we put out this scheme to provide more choices for drivers. Next, Mr. Michael Teen. Thank you. I think we all remember there are 2 accidents involving Hong Kong people on the mainland on the Easter holidays. In Fuzhou, there were 4 Hong Kong residents who passed away in the traffic accident, and their families were not notified until a few days later. There were people who say that the mainland authorities receive traffic accidents reports every few days. If they have to notify the public for every case, then it will create panic. And so they will only make reports regularly on the number of traffic accidents. But I hope that the family members can be notified if their relatives are involved in traffic accidents. Previously, the authorities will inform the Guangdong office will inform the family members if they are involved in certain traffic accidents. But why was it not the case in the accidents that happened a few months ago? There will be more people traveling to the Guangdong province under this new northbound travel. But we understand that there is different driving culture between Hong Kong and mainland. In mainland, we use left-hand drive, and there is different traffic light regulations. Even with the help of GPS, there could be an increase in the number of traffic accidents. How do we set out a clear notification mechanism? This is very important. For us, the roundabout, would like the administration to formulate a clear notification mechanism such that when Hong Kong people are involved in traffic accidents, the main Guangdong office will inform the Immigration Department of Hong Kong, and the Guangdong ETO will inform the Hong Kong Immigration Department of these accidents. Thank you. Other members also posed similar questions. Guangdong and Hong Kong governments attach great importance to this issue currently. We have a mechanism in place. Our colleagues in the Immigration Department that are posted on the mainland will provide assistance to people involving in traffic accidents in the mainland. When the northbound travel is being implemented, we will keep in close liaison with the Guangdong counterparts and arrange for colleagues to help out these people that are involved in traffic accidents. And we have also discussed with the Guangdong governments on the notification mechanism. How do we help people and their family members who are involved in the traffic accidents? We will continue to improve on that. Now, you will ask the mainland authorities to inform the ETO of Guangdong, and then they will notify the Immigration Department. Is that the case? Is that the arrangement? Thank you. Now we are discussing with the Guangdong provincial government on how we can strengthen the mechanism. When we have information ready, we will share it with members. Thank you. Mr. Yu Pak Lim, please. Thank you. We've been looking forward to this northbound travel for Hong Kong vehicles. I welcome the implementation. This can encourage exchange between Hong Kong and Guangdong residents. I would like to know more about the scheme. Now, there will be 450,000 eligible Hong Kong private cars that are expected to be benefited. Have you estimated the number of applicants who will be interested in the program or scheme? Now, there was another scheme of self-driving in Guangdong province. I'm not sure if you have any statistics on that. There are issues with vehicle examination, insurance, and driving licenses. Members have asked these questions. This will affect the incentive of drivers to apply for the scheme. You also mentioned in the papers that you will add another land-based boundary control point such that people can travel to and from eastern and western parts of Guangdong. Are you talking about Hung Yuen Wai Port? Because if we're talking about eastern part of eastern part, I think it will be the Hung Yuen Wai Port. There are few vehicles under the regular quotas using that port currently. If the Hung Yuen Wai Port is included under this northbound travel scheme, now the mainland license plates can only enter the mainland using a particular boundary control points. Can we relax the restrictions such that drivers can use boundary control points at the Shenzhen more flexibly, such that they can also make use of the Hung Yuen Wai Port? Thank you. I will extend the meeting for 10 minutes. Thank you. First, I would like to talk about the Shenzhen Bay scheme, that is the self-driving for Guangdong province scheme. Before the pandemic, because during the pandemic we cannot travel to the mainland, but before the pandemic in 2018 and 19, there are about 2,500 vehicles using the scheme to travel to the mainland. For this customs guarantee-free policy is very important under this scheme. So we hope that with this arrangement, more drivers will be interested. But it's hard for us to estimate out of these 450,000 eligible Hong Kong private cars, how many of them will apply. But we want to make it convenient for drivers to enter the mainland. We will reduce the application fees such that it will be more attractive comparing to our existing schemes. As for which land-based boundary control point will be added, we will take a look at the control points and we will select the most convenient one. In due course, we will propose that and have a discussion with the members. In order to facilitate mainland license plate vehicles to use other boundary control points, we have actually allowed them to use all the bridges between Hong Kong and Shenzhen. After pandemic, the shuttlecock port cannot be used. The vehicles will use then other ports. We will keep in touch with the Guangdong government. Next is my turn. Now, in Macau, they have 2,000 quotas. Our population is 10 times that of Macau. In terms of number of vehicles, we're at 4 times that of Macau. If they have 2,000 quotas, then for us, we should have 8,000 or 10,000 quotas. Of course, I don't want there to be any quotas. When will the government promulgate the figures? As for the closed road permit, when the borders are opened, a large number of vehicles will have to apply for a closed road permit, and there are long queues in the transport department offices. Now you have streamlined the procedures, but there is still queues in your offices. The same case will happen again next year. As for this closed road permit issue, can you issue it when the applicants are having their vehicles taken to vehicle examination centers such that this will not hinder people usage of the northbound travel scheme? Will you talk to the Security Bureau if we can make legislative amendment regarding the closed road permit? Regarding integration problem on left-hand drive, right-hand drive, and fare booth, as well as issues relating to car parks, we do need integration. It's not the case that everything will change for the benefit of the Hong Kong people with such a scheme. I hope that the drivers will be prepared, because we need to adapt to the Greater Bay Area. We should not have this mentality that the mainland will change everything for the benefit of us. There is another concern. What about Guangdong vehicles traveling south to Hong Kong? There is such an idea circling around in the community. Now, Hong Kong's roads are narrow. It may cause more serious congestion in Hong Kong. Do we have a discussion for southbound travel for Guangdong vehicles?
Thank you, Mr. Chairman. On quota places, other members asked about that too. We will try to ask for a larger quota as far as possible. But then we also have to consider the handling capacity at the boundary crossing points on the mainland and on the Hong Kong side. And now we're starting a scheme in July, and there will be a pre-booking system. Certainly before the start of the scheme, we'll be able to announce the number of quota places Of course, we'll try to strive for a larger quota, but can we provide more quota places later, or eventually there will no longer be quota limitation? Well, yes, we're moving in that direction. As for closed road permits, it's true. After the resumption of normal travel, there are more renewal cases for closed road permits. The Transport Department immediately streamlined the process. And so by the end of April, we are able to clear most of the backlog. So now it takes 5 days to apply for the permit. And we have actually considered whether we could streamline further the whole process involving the paper-based process and so on. We are actually working with the relevant bureau and law enforcement agencies, and we're talking to them about it. Finally, southbound travel of Guangdong vehicles. We're taking things step by step. We are trying to gain experience with the northbound travel of Hong Kong vehicles. And then at the Hong Kong-Macau Bridge, there is now a car park with 6,000 parking spaces. So for vehicles coming from Macau and Guangdong, the self-driving drivers could park their vehicles there at the Hong Kong-Macau Bridge. So this is a measure to promote the integration of the Greater Bay Area. As for other options, we are considering them too. If there will be southbound travel of Guangdong vehicles, we welcome people to come to Hong Kong, and because we want to develop the Greater Bay Area, so we should try to promote the flow of people and vehicles as far as possible. But then, of course, Hong Kong has limited space, and we have the limited road network. How can we make sure that the measure will work properly? We need to look into that. Thank you, Mr. Perry. It's almost time. I'll give you 2 minutes. Okay. Well, yes, just a short question. Now, for northbound of Hong Kong vehicles, there is need to obtain this temporary permit for motor vehicle, and there's some limit of 1 year, the validity of 1 year, and is the term is the same as that for the insurance policy. So would it be a renewal thereafter, or will there be a new registration, and there's need to get a quota place again? And do you also have measures to target cross-boundary vehicles carrying passengers illegally at a fee? Well, we mentioned the maximum period is 1 year. And of course, the period is based on the policy period. And after the 1 year is up, then there's need to make a new application. And as to whether there's need to get you to apply for an allocation of quota place, it depends on whether all the quota places are used up or whether we've already increased the quota places substantially. And so in any case, it has to be a fresh application every time. Yes, illegal ferrying of passengers. Now, in the Guangdong management method, it's already stated that private vehicles under the scheme cannot be used for commercial purposes. So if it's ferrying of passengers at a fee, it's already commercial use, it's not allowed under the northbound travel scheme. And if we spot such vehicles, and the customs and the mainland authorities will step up the exchange of information. And the people will be penalized if they do so. And then also maybe another application will not be considered for a certain period and whatever. So there could be various means to deter that. Well, of course, I don't expect people to rush to apply under scheme, because it's not that easy for people to adapt to driving on the mainland. So that's all for the meeting today. Any other business? Nothing else on the AOB meeting adjourned. Thank you very much.